अस्सलामुअलैकुम, आवाज आ
Can you hear me, doctor? Yes, let us wait. Let me go online, then we will start.
Yes, sir, I can quite hear you.
Good morning, good evening, good night, everybody. I'm Dr. Che, and today we will discuss some speaking tips. So if you can hear me, just let me know, please, in the comments below. Just let me share the session, and then we will start. Okay. If you can share the session with other doctor, nurses, and pharmacists, that would be great. So we will do today some speaking role plays for doctors and nurses for both of you. So just let me share the session and then we will start, okay? If you can hear me, just let me know. Okay, just a minute, please. Let me share and then we will start, okay? Share. If you can share the session with other doctors, nurses, and pharmacists, that would be great. If you cannot, that is also great. Okay, thank you so much, all of you. Now let us start. So I think we have two students with me. Just okay, doctor, can you see my screen? Dr. Hamdan, can you hear me? Dr. Hamdan, but I cannot hear you. Please
Yes,
unmute. Yeah,
yes,
okay.
sir, I can hear you.
Are you a doctor or a nurse?
I am a doctor, sir.
Okay, great. And when is your exam?
Sir, on 27th of August.
So it is very close. So today is 22nd, I think so. So we have 5 days. So doctor, we will do this doctor's role play. Then we will do one nursing. Then if we have more time, then we will do one more for doctors, one more for nurses. So doctor, this is your role play. You have 2 minutes to prepare for your role
Okay.
play. Just those who have joined just know. So we have 2 minutes to prepare, just like in the real exam, the student is preparing the role play. Then we will do role play and then I will give the feedback. He will be the doctor, I will be the patient. Okay, so let us wait for him to prepare, then we will start. Let me know, doctor, once you are ready to start.
Yes, sir, I am.
You're ready?
Yes, sir.
Okay, so let me see where I can note the time. Just let me. Just one. Okay, start, please.
Good morning. My name is Dr. Hamdan and I am one of the fitting physician today. Can I have your name and age, please?
Yes, doctor, I am Jenny and I have 50 years.
As I see, you are accompanying with your child. What's the age of your child?
My age, my son has 5 years.
Okay. So, Jenny, what's bring you today here?
Uh, doctor, I am here because my son has cough and fever.
Okay. Can you tell me more about that?
Yes, he is having this fever and cough for the last 3 days.
Yeah, Jenny. As far as I know that you denies the passing canola to your son for the second time, as the first one was blocked on the second day of treatment. So let me assure you that if you don't want this canola and if you want your child have only oral medications, this will not effective. Do you understand what I am talking about?
Yes, doctor. But doctor, my son, already is disabled. He has this palsy, and the nurses were trying, and it was very painful for him. Please, doctor, I don't want him to pass cannula, please. He has a lot of pain.
Well, Jenny, let me assure you that by passing this canola thing, we administered the IV medications to your son. As your son has experienced severe pneumonia, so it is important that he would get his medications via intravenous route, and which is only possible because of canola. If you don't allow us to do that, then I ho- I fear that your child's symptoms will get worse and less effective with the oral medications. So I think you do that for the second time. Um, I recommend you that for doing this. And let me assure you that if we do this second time, and the person who was doing this canola is a very senior doctor and an experienced one, so we also apply as anesthetic gel to decrease the pain. So in my opinion, that you should go for it. It will cause less pain than the previous one, and we would take care for the canola to not block again. Can you
Yes,
understand what I am talking about?
yeah, doctor, I understand, but doctor, the problem is he is already disabled, doctor, and you know, when he feels pain, he is in stress. I can't bear.
Uh, well, Miss Jenny, I understand your concerns, and it must be very hard for you by seeing your child like this. But let me tell you that if you not allow us to pass this canola, then your child will not get any better. It only he only can be better by IV medication, and which can only be administered by the IV route. So I recommend you and strongly recommend you that you should go for this canola thing. And I assure you that this time a senior doctor passing this canola, and your son will not feel any pain, and it's best for your child's health. Don't you want your child to be get better?
Yes, doctor, I want him to get better. Please give some tablets. I will give him mixed with water and he will take, please.
Well, Miss Jenny, let me tell you that the oral medications are less effective in the severe condition like your child has. We should go for an IV route, which is more promising by showing the results to get better. By giving oral medication, the process of getting better of your son is too long, and it's less effective. So, do you agree if we go for another time of passing this canola?
Yes, doctor, yeah. But doctor, I don't want him to have a lot of pain.
Well, he doesn't get any pain because we use an anesthetic gel to decrease the pain, and we will take care of this canola to not block again, and you will not experience any discomfort further. Do you
Okay,
do
doctor.
that?
Thank you, doctor. Yes, yes, doctor. Thank you.
Well, thank you for seeing me. I
Thank you,
hope
doctor.
that this will help your child to get better. Uh, I wish you a speedy recovery. Take a good care of your son.
Thank you,
Goodbye.
doctor. Thank you. So, the people who are with us on Facebook, please write in the chat what should be the score. Okay. I'm coming back in 2 minutes. I need to see a patient. Write in the chat what should be the score for this role play and what are the weak points, what are good points, what are the weak points. Just quickly write. Okay. Please quickly write. Then I'm coming back. Please quickly. Okay, so thank you so much, all of you. Let me see the score. It is sure 350. B, C plus, I guess. C, B, C, C plus, B, C plus, C plus, B. Okay, so Dr. Hamdan, I will say that you are at borderline. You can see people are not sure it is B or C plus. So you are at borderline. It means you can get B possibly, but if you get B, it would be only 350, but maybe you get 340, 330. Okay, so you still have time. We can improve. Okay, I will give you a specific feedback I have written here on my page. Just let me open here, please. Actually, doctor, can you hear me, doctor?
Uh,
Okay, you need to go step by step. Okay, don't tell all the things to patient one time at one go. Okay, just tell one thing, and you have not shown any good sympathy, empathy. Okay, actually, what is the main issue of this patient? Why she is
she
denying?
is
Because she
because
has
pain.
baby is, yeah, actually the baby is handicapped. Okay, palsy, palsy. Okay,
Yes.
so this is the main issue, and the main thing here is if we show sympathy. Yes, Miss Jenny, I totally understand that it is painful for your child, but for the safety and the health of your child, we need to give him medication through his vein. Don't say intravenous, through his vein. Okay, like this. The main thing is just in different words, keep showing sympathy, empathy. Okay, so first of all, you don't need to ask my age. Okay, my age is not important. Okay, you can ask my name. Even you can ask my name during preparation time. Okay, so mother's name or father's name. Then is you need to ask child's name and age. Okay, it is better to when you are talking with me, call me by my name, and instead of saying again child, if I say his name is David, so may I know how David is doing or something like that. You can make it up. So this thing, name of the mother or father, and name and age of baby. Okay, name of the mother even you can ask during preparation time. In the OET exam, we can ask these things in the preparation time. Then your start was not good. You were asking me how why I came here. He was having cough and fever, and okay. So actually here the main thing is the concern for us, mother concern, and we already know about when from this background information. You already know what is the concern about cannula. Okay, not I'm here for the first time. Baby is already admitted. Okay, there was one cannula that was blocked, and then we were trying another one. Okay, so how you will start again? Can you think how you will start?
Yeah. So I
I
can start like that.
yeah, I am Jenny, and my son's name is David. Okay,
Yeah.
morning, Jenny.
Uh,
Good morning, Miss
uh,
Jenny.
Good morning, Miss Jenny. As I see, your
I'm
son
doctor.
has a very
Introduce
serious.
yourself. Introduce yourself.
Okay. Uh, Hi, Jenny. My name is Dr. Hamdan, and I am the routine physician in this hospital. So, what we have here, I see that you denied the
No, no, denied. No,
canola passing.
denied. No, doctor, denied is little bit strong word. Okay, and don't tell me
Yeah.
what you already know. Okay, okay. So
Okay.
first we can ask overall how my son is doing. Okay. Good morning, Miss Jani. I am Dr. Sarmad, one of the doctors here in the whatever department is he. Okay, here in the clinic, in the department, whatever. Okay. So could you please could you please confirm your son's name and age for me? Yes, doctor. He is David and he is 5 years. Okay, Miss Jani, I can see from my notes that uh, David was admitted here in the hospital Could you please tell me how he is doing now? This is just one thing to build the rapport. Okay, how he is doing now? Then I will start opening. Okay, doctor, he was admitted here due to cough, pneumonia, whatever. But the problem is, doctor, okay, I can tell the problem. I can tell how he is doing now. Doctor, he is not doing well. He is ill. Ill means severely ill. Okay. Okay. So, okay, Miss Jani, is there anything else that I can help you with? Yes, doctor. The nurses were trying to pass the cannula, and he was having a lot of pain. And I don't want him to pass another cannula. Okay. Okay, doctor.
Yes, sir.
Okay.
Yes, sir.
Now you have asked the concern from patient's own uh, means in own words. Okay. Now, now you will ask. Okay. Now you will. Do you know, Miss Jani, why we need to pass him the canola again?
Okay.
Uh, Okay, you will assess the knowledge. Okay, I don't know, doctor, but doctor, he is having a lot of pain, and this. Okay, Miss Jani, I totally understand that passing a cannula uh, can be a little bit painful. But let me tell you, Miss Jani, that as your child has severe pneumonia, and as you know that he has this condition, cerebral palsy, and that is why this infection might be a you know we can say something very severe for him, very okay, not good for him, something like that. Okay, yes, doctor, I know, doctor, but okay, it is very painful for him, and okay, that don't tell IV route and these things, it is very painful for him, doctor. I myself will start. Can you give me oral medication? Then you will give why we need to give IV medication. But doctor, is it possible to give him medication through his mouth? Because the cannula is very painful for him. He will not tolerate it. Miss Jenny, I totally understand your concern as you are a very caring mother, and you want the things that would be less painful for you. But unfortunately, as your son's condition is severe, his infection is severe. If we give medication through his mouth, the medication would be less effective. But if we give through vein, that would be much. Okay, he will heal quickly, whatever you can say, doctor. Okay, like this. But doctor, the nurses were trying to pass, and I think they are not experienced. Doctor, please, I don't want him to have too much pain, something like that, I will say. Okay, then you will offer the last thing. Miss Jenny, I totally understand, as your son has difficulties, and he has background condition, and I totally understand that you care about him. Then what I can do for you is I can call my senior doctor, okay, who is most experienced in passing the cannulas. He is a specialist in anesthesia, means who puts the patients in sleep. So he will try to pass a cannula, and I hope he will do it as quickly as possible, and it would be less painful. Okay, doctor. What another thing is that this time we will apply a numbing gel, okay, so that it is less painful for him. Then I will agree. Okay, doctor, thank you. Can we do it again?
Yes, sir.
Okay, start please.
Hello, my name is Dr. Hamdan, and I am one of the treating physician here in this hospital. Can I have the name and age of your child, please?
Yes, doctor, I am Jenny, and my son's name is David, and he has 5 years.
Um, well, Jenny, how is your son doing?
Doctor, he was admitted yesterday. And doctor, he is still in the same condition, doctor. He is not improving.
Um, well, Jenny, uh, I can see there that you refuse this
Refuse, don't
canola
tell me,
thing.
doctor, don't tell me I refused, please.
Okay,
Yes, Jenny, is there anything that I can help you for your son? Okay, is there anything that I can help you? Okay,
okay.
do you have any
Jenny,
concerns like
do
this?
you have any concerns?
Yes, doctor. The problem is, doctor, he had some one cannula that was passed yesterday, and when they have passed, it was very painful, and now it is blocked, doctor. And I don't want him to pass another cannula, doctor. No, no.
Oh, I am so sorry to hear about this. And I am quite understand about your concerns regarding your child uh, who is struggling between his conditions. But let me tell you, Miss Jenny, that this canola is very important for your son. Your son has a very severe pneumonia, and there are only medications which we give through veins that can help
Doctor,
your
don't
child.
tell me all things in one go, please. Just explain one thing. Explain one thing. The second bullet point, okay? Yes,
Okay,
your
okay.
son's condition is severe. He has severe pneumonia. Okay. And apart from that, as he has a history of
Cerebral
cerebral
palsy,
palsy,
so
he is
it will very
vulnerable. He
quite
is vulnerable
serious.
to get. He vulnerable to get severe infections, and it is very difficult in this case to treat something like that. Okay, then stop. Okay, let me
Okay,
talk also.
okay,
Okay,
okay, sorry.
okay, doctor. But doctor, it is very painful for him. I cannot bear him. I cannot see him with such a pain. Is there a, yeah, doctor, what do you think if you can give him a medication through his mouth?
Well, Miss Jenny, I quite understand your concern, but let me tell you that oral medications are not going to help your child in this case. We should go for medications that we want to administer to the vein of your child. It is very important that we do things like this because by doing this, your the improvement of your child uh, have a have a better chance of improvement of your child's health. But by doing oral medications, I'm not quite sure about the condition.
Okay, long, no long explanation, please make it short. Okay, don't make it too long.
Okay.
But doctor, yesterday many nurses were trying to pass cannula. His veins are very weak, and they were trying on many places, and it was very bad experience for me and my son. Doctor, I understand that it is important for him to take medication through vein, but
Yeah,
doctor, it was
Jenny.
very painful. Yes, doctor.
But let me reassure you that in this time we would have a senior doctor that will pass this canola, and senior doctor is most experienced in passing the canolas, as he was working in our anesthesia department, who deals these things uh, regularly. So you don't have to worry about it. Let me assure you that he will take good care of your son by passing this canola. Do you understand?
Okay, doctor. Yes, doctor. But is there anything else that you people can do to decrease his pain, doctor? Please.
Yeah, Jenny, sure. We can have an numbing gel that will decrease the pain of your child. As we
Okay.
apply this gel at the site of the canola, and this canola will not hurt as much as the previous one does.
Very good. Excellent.
Did.
Okay, doctor. Okay, doctor. Yes, you can. No,
Okay, thank you
at
for
that.
agreeing with me. I wish you a speedy recovery of your son.
No, wish me no
Goodbye.
speedy recovery. So you will ask at the
Okay,
end, do you have any other concern, Miss Jenny?
okay. Do
Ask
you
me.
have any concerns, Jenny?
Any other concern?
Do you have any other concerns, Jenny?
No, doctor. Thank you so much, doctor.
Okay, thank you.
I wish a speedy recovery for your son.
I
Thank you so much. Like this. Okay.
okay, sir.
Okay, doctor. What you can do is try to get some feedback. Okay. I'm not telling get feedback from me because I'm too busy. I am not giving paid classes. But from anyone apart from that, get feedback from any expert. And apart from that, try to do some role plays with your friends. If you don't have friends, you can post in Facebook groups. Okay. And get some speaking partner and try to do some role plays. Okay.
Okay, sir.
Okay.
Thank
Thank
you
you.
so
So
much.
now Miss Florence. Yeah. I don't know name exactly.
Yes,
What is your
sir.
name, please?
Amucho.
Okay. So nursing. Yes.
Yes,
You are a
Amana.
nurse. Okay. Now let us do
Yeah.
one role play. Overall, the approach is same. If you are a doctor, you can also listen to us how to approach. Okay. Anyway, overall the things are same, how to do sympathy. Even doctors can learn better in nursing role play because in nursing the main thing is sympathy, empathy. Okay. So let us, by the way, these are my own samples, so there's no issue of copyright and these things. You know, we also have to take care of copyright and these things. Okay, dear, this is your role play. 2 minutes to prepare, please. Okay. 2
Okay.
minutes to prepare. Let me know when you are ready, please.
Okay.
I think we should start. Yeah.
Okay.
Okay. So start now, please. Start, please.
Okay. Hello. Hello.
Hello.
My name is okay. My name is Komoto Ramato. I'm the nurse in charge here today. Do you mind telling me your name?
Yes, I am Smith.
Okay. I didn't get that. You were saying you were?
Yes, please.
I didn't get your name. Sorry. You were saying you were?
Sorry, I don't understand. My mother's name is Jenny. I'm Smith.
Okay. Jane, right? The patient's name?
Yes.
Okay. Do you mind if I may ask you a few questions
Yes, please.
regarding your mother?
Yes.
Okay. Thank you. What brings you here? What brings your mother? What brings Jenny here today?
Doc, nurse, you know, we have been waiting here for the last 1 hour, and my mother is seriously ill, and no one came here to see her.
Okay. What's wrong with your mother, if I may ask?
But why nobody came here to see her? She has fever. She has problem with urine, but nobody came here to see her.
Okay. I understand your concern. I understand your concern. Can the reason why your mother hasn't been seen by now is because the we are busy here today, right? Do you understand that?
Yeah, I
There are a lot of
understand, but
patients
my mother
today.
is also my mother is also seriously ill. Nobody came here to see her.
Okay, let me try to clarify something here.
Yes, please.
Do we see a lot of patients who are critical, and most of them are critically ill, and doctors, they try their own means to help everyone here. They, by attending who are more sick, and then they will come and attend according to the condition. All right? Do you understand that?
Yes, yes, nurse, but I don't know what should I do.
Okay, you have to wait until the doctor comes and attends Jenny.
Okay, doctor.
All right. Can I ask you a few questions regarding Jenny's condition?
Yes, please, nurse.
What are her symptoms?
Yes, just she is confused and she does not recognize anybody, and she was having some problem with her urine.
Okay. Okay, then let me try check her vital signs while we are waiting for the doctor to come and attend her.
Okay, you can check, yeah.
Okay. While I'm just checking her, let me try to tell you about urinary incontinence. It's not a serious, life-threatening condition, all right?
Is this a serious condition?
It's not a serious, I was saying it's not a life-threatening condition.
Okay, nurse.
Okay, I've checked the vital signs, and they are all normal, except her temperature is high.
Okay, miss.
So I'll give her, okay, I'll give her paracetamol to help bring down her temperature to normal, all right?
Okay, okay, miss.
And then I'll try to talk to the doctor to come and attend her.
Okay, nurse, thank you.
Is there anything else you want to be helped with?
No, thank you, nurse.
Okay, thank
So
you.
first of all,
I'll
your
go talk to the
voice is
doctor.
not clear. If anybody wants to practice with me, please make sure that you have very good internet connections and hands-free or these things are very good. So, but at least it was understandable a little bit for me, but many people were saying that it was not good sound. But let me tell you, nurses, and for doctors also, why in this role play, what is the main thing? What is the main thing in this role play? What is the main thing in this role play? What is the main thing in this role play? Actually, this is a difficult patient, angry patient. This is the main thing. The main thing is we need to reassure, we need to apologize, we need to say sorry. Most of the nursing role plays are like this, and some of the doctors role play are also like this, difficult. So this is angry patient, difficult patient. So we need to be reluctant. No, Miss Nasim, reluctant. No, I'm not reluctant. I'm angry. Okay. Nobody came here to see my mom. She is seriously ill. She will die and this and that. No, there is no doctor, nothing. You people don't care about our patient's health. And okay, like this. Okay. So this is the angry patient. So main thing, if you get any angry patient, most of the nursing role plays are angry patients, difficult patients. You people will not treat the patient. You just need to reassure, be very kind, be very sympathetic, reassure the patient. Okay, apologize, say sorry, apologize, be very polite. This is what you need to do. Okay, so now I will tell you how to approach this patient quickly. Okay, you can ask my name during preparation time. You can ask my mother's name during preparation time. Okay, so I am Smith. My mother's name is Jenny. Okay, so good morning, Mr. Smith. I am Sidra, one of the nurses here in the emergency department. I can see that you are here with your mom. Okay, you can say my name also. So how can I help, please? By saying that, I can see that you are here with your mom, with your mother, with your mom. It means you are acknowledging that the patient is not mine. Okay, the patient is my mother. Okay, so how can I help, please? You will say like this. Then I will start. Okay, I will start telling things that will show that I am angry. No, my mother is here for the last 1 hour. Nobody came here to see, and this. Then you, Mr. Smith, I'm really sorry. I'm really sorry that no one could come here to attend your mother, and I can see that you are waiting with your mother for the last 1 hour. It means you are acknowledging my anger. Then I will a little bit calm down. Okay, then you will need to explain. Okay, actually, Mr. Smith, this is emergency department. We have very critical patients, very severe patients, critical patients, and all the doctors are busy and they're attending other emergency patients. No, I will burst again. Nurse, my mother is also is in emergency. She ill and this and that. Mr. Smith, I totally understand your concern. And as soon as any doctor is free, and he will come here to see your mother very soon. And I'm really sorry for the delay. And we are here to take care of your mother, just like this, something like this. Okay. Then slowly I will come down, I will calm down, and then you need to start asking, okay, Mr. Smith, could you please, while we are waiting for the doctor, could you please tell me what your mother was experiencing, not say symptoms, what your mother was experiencing, or why you brought your mother here, something like that you can ask. Then I will say that she has dementia and she is confused, she has problem with urine like this. Okay. Okay, then you will show sympathy, empathy. If I ask, is this a serious condition? You will reassure me, hey, this is not a serious condition and this and that. Then you will ask me while we're waiting for the doctor, Mr. Smith, is okay? Is it okay if I can check your mother's vital signs so that once the doctor comes, I can tell them about what is about your mother's vitals? Yes, 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 nurse, you can. Okay, Mr. Smith, I have checked all the vitals. Let me reassure you. Okay, why the vitals are normal? You are can reassure. Let me reassure you that his heart rate is okay. She is breathing well. Okay, only she has a temperature of 38. Okay, so I will be giving her paracetamol to decrease her temperature while we're waiting for the doctor. Okay. Okay, then at the end, you can again say apologize. You can again say that the doctor will come and will attend your mother as soon as possible. And okay, like this is how we need to do things. Okay, the main thing in nursing role plays is the sympathy, sorry, reassurance. Okay, these things. So, anybody has any question? Anybody has any question? You can ask me in the chat. Okay, if you have any questions, you can. Many people were saying how they want to participate in the session. Actually, I can take only 1 or 2 or 3 role plays in 1 hour almost. So everybody is not able to participate. I'm really sorry. Okay. So the main thing is uh, you need to know how to approach the role plays, make some speaking partners. Okay, try to practice with each other. The one way is just write a post in Facebook groups. On Facebook groups, write a post, I need speaking partner, write your exam date, write your preference, time zone, whatever. Okay, so this is what we can ask. Unknown case name during the role play. As an OET, you can ask name during preparation time. How can I call you? Okay, so this is okay. In OET is okay. Paracetamol is okay. We can give paracetamol. Okay, you cannot prescribe, antibiotics and these things. Just you can verbalize that I will be giving her medication. If you don't want to mention paracetamol, I will be giving her medication to decrease her temperature while we are waiting for the doctor, like this. Okay. So if you go to YouTube, just search my name, DrChe, plus name of your exam, OET, DrChe OET. You will see there are some role plays. Okay. Okay. Actually, the role plays like that, patient will not become too, if you are trying to say sorry, you apologize, you understand her anger, you acknowledge her anger, then the patient will quickly will calm down. Okay, will calm down. Patient will calm down. Don't worry. In OET, you don't need to worry about these things. Patient will calm down. Okay, so if you have any questions, you can ask me on my WhatsApp. So thank you so much for your time. Thank you.